Well, good morning, everybody. It's really great to be here and share with you some very exciting news that we think bridges the gap between what was once just a dream a few years ago to actually having impact on each and every one of our lives. And that is this device we announced yesterday that will be able to read the entire human genome in a couple of hours and for about $1,000. And this is really an amazing piece of technology, and since this is a technology show, I will get to in a moment how it works, because I think you'll find it actually quite interesting. But maybe first is just to set the context for what's going on here in terms of reading a genome and why is yesterday's announcement so important. About 10 years ago, there was an international human genome effort project to read the first human genome. That's all 3 billion bases of the DNA that you have in your cells. And it cost about $3 billion. It took several years just to get the first human genome decoded. If you fast forward the clock, and you go forward 10 years, last year you could read a human genome for about $5,000 to $15,000, but it still took upwards of a month or more, as Eric Topol could convey to you, to decipher what it all meant and actually get something that could be then acted upon. And these were very big machines, and certainly we're one of the providers of those, and quite frankly you needed to have an equally big PhD to operate it. It's just a very complicated device. So what we announced yesterday, though, speeds the clock up even more, and in fact it's moving at about 4 times faster than the venerable Moore's law that governs the semiconductor industry. If you just say 3 billion 10 years ago, and now $1,000 in a couple of hours, this has been a remarkable rate of technological innovation. And the big breakthrough that has now taken place is that we have been able to take these giant pieces of machinery and essentially reduce them down onto a semiconductor chip that's about this big. And it is the very first time you've also been able to bridge the chemical world of reading molecules in your body and converting it to digital information, hence why we're here at a digital health show and forum, and then potentially do something with it. So now the next question is, what does this mean in the world of medicine? Well, I'm going to defer to my colleagues here to the left, who are both MDs and certainly are in the world of medicine to a much greater degree than I am. But I would just simply say that at least how we think about now what this technology unlocks is the possibility of really moving medicine into the genetic age. And we think this is an irreversible course where we're going to be probing, interrogating ever deeper at the molecular level of what's going on in your body to solve disease at a much, much earlier stage. And of course, the very first disease that I think we'll be going after is cancer. Cancer is a disease of the DNA, and therefore it just makes kind of obvious sense that now that we can read the DNA very specifically and quickly and economically, we can then potentially act upon it. And certainly we could potentially do that much earlier in the phase of cancer before it gets completely complex and your DNA completely rearranged, and then it's just very hard to act upon. And so that's how we think about what this technology is going to unlock, is first in cancer, then many other indications that allow us to get these answers much faster. We think fundamentally in the next few years, we're going to understand the driver mutations, that is the defects in your DNA that are at the origin of your cancer. We're going to see them much, much sooner in its advent into your body, and then potentially and hopefully there are therapeutics that could be rightly prescribed for you so that we're not prescribing the wrong drugs and they act upon it, they do something for you, and you feel and obviously could be potentially cured. Now, having said that, we think cancer will ultimately be more like HIV, where it's a constant managed disease, that as your DNA then does evolve in your body, that future drugs will be required to keep it in check. But again, I guess I'm getting into medicine. But I would just simply say this technological breakthrough is a very big deal. Because heretofore, before this point, the machines were too big, far too expensive, took weeks, if not months, to get the results. And now literally this machine is at the size of a printer that could be on your desktop. A clinician or a technician just pushes a button by putting in the sample, and a couple hours later you have the results. We have pushed the limits of computing to get all of that information back into a decipherable report. Again, we see a clinical encounter taking place in the world of cancer in the very not too distant future, where you come in on Monday, you get worked up, the analysis takes place overnight, and then the next morning the oncologist is sitting down with you, telling you about the mutations they see in your DNA, and hopefully being able to prescribe a therapeutic that will work just for you. We think that's the world of personalized medicine. We think this is an incredibly interesting, exciting time in terms of how health becomes digital, becomes genomic, and we're just really pleased to be able to play a role in it. Thanks very much.